We also have papillary muscles and chorda tendineae associated with the right ventricle, specifically associated with the tricuspid valve. Therefore, we have 3. Whereas the left ventricle associated with the mitral or bicuspid valve, although having papillary muscles and chorda tendineae, is only going to have 2 because that mitral or bicuspid valve only has 2 leaflets or cusps. So although both ventricles have trabecular carinae and papillary muscles as well as chorda tendineae, the amount is what varies. And although both ventricles have a thicker myocardium than the atria and are associated with pumping blood, the right ventricular wall is always going to be 1/3 thinner than the left ventricular wall, which is always going to be 3 times thicker. However, if the left ventricular wall exceeds 1.5 centimeters, then it is hypertrophied. And this can have some clinical relevance with a hypertrophic cardiomyopathy, which is the most common cause of sudden death in young athletes. The left ventricle also forms the apex of the heart, which we can locate externally at the left fifth intercostal space at mid-clavicular line. Now, aside from these 3 chambers, the left atrium has the opening of the pulmonary veins, which there are 4, 2 left and 2 right. It has no pectinate muscles, as we stated earlier, as the pectinate muscles are only within the right atrium and the left and right auricles. Speaking of the left auricle sits on top of the atrium, just like the right auricle sits on top of the right atrium, but the left auricle is smaller than the right.